Hello, I'm Dr. Liza Bulsara. I'm a pediatric hemato-oncologist, and today we are talking about thalassemia, which is pronounced as thalassemia. It is a kind of anemia which is found in children. So basically, this is a genetic disorder where there is an ineffective erythropoiesis, which means either the blood is not being formed in a proper way or it is getting braked and dying soon, more than earlier than it is supposed to be. In which children it is found, it is basically a genetic disorder. So when a thal minor mother marries a thal minor father, there is 25% of chance that the child may be thalassemia major during every pregnancy. So we will have to get HbA2 test to prevent this disorder. This disease is diagnosed as early as when the child is 4 to 6 months of age. It can be also later diagnosed to 2 to 3 years of age. And in this disease, when the child is being diagnosed, he has to get multiple transfusion almost every 21 to 1 month gap till he survives it. Initially, it was said that the child who has thalassemia major only survives up to 9 to 10 years of age. But due to the recent advances of medical technology, now they are thalassemic major almost surviving to 68 to 70 years old. So what are the signs and symptoms what a thalassemia major child might have, or which is useful in early signs and symptoms for diagnosing it? The child may be pale. He may be having an abdominal protrusion. He might be falling ill very frequently. There will be a whitish pallor, which because of the blood is less, and there might be a yellowish of the skin. Abdominal protrusion with hardening of the right and left side, which is liver and spleen. The child may be crying incessantly, and because of the repeated admissions, there would be no diagnosis found. And when the CBC is done, which is complete blood count, HB is found to be 3, 4. And in that cases, we do further evaluation by doing a test HB electrophoresis, where fetal hemoglobin HbA2 is seen. And in this cases, we found that the child is beta thalassemia homozygous, which is thalassemia major. When we find the child is thalassemia major, we do the parental screening for thalassemia trait, and we confirm the diagnosis with the parents' report also. What are the treatment options given in this disease? There are three headings in this. One is care, one is cure, and one is cure. The care is taken by regular blood transfusion, almost 21 days to 30 days. The aim is to maintain pre-transfusion HB between 9 to 10.5. When the child has given 10 to 12 transfusion, or he becomes about 18 to 2 years, we do a serum ferritin test to see what is the iron in the body. When this increases more than 1000, we start iron chelation, because not only the iron is going through the blood, which is transfused, but there is some improper mechanism where the iron is not excreted from such children. So we start iron chelation in the form of Desirox, Calfer. These are dispersible tablets, and further we even give it through subcutaneous route or IV route also. There are multiple multivitamins to be given in this disease, like folic acid, zinc, vitamin C when the child is on IV Desferal. And over the time when the child achieves puberty, there are a lot of series of tests to help them to achieve the great height and the weight as per his age and the weight. We are talking about regular transfusion. There are a lot of daycares which helps them to get this treatment free of cost or at the minimal rate. There are a lot of help which is given for this blood transfusion, everything. Blood is given free of cost by State Blood Transfusion Committee, and they need to have that SBTC card. The iron chelation is given free of cost by most of the government PHCs for these children. There are monthly, yearly, and 3 monthly tests to be done in this disease. CBC is done almost pre-transfusion every time. LFT, RFT, and serum ferritin is done 3 monthly. And annual tests consist of USG abdomen, 2D echo, thyroid function test, hormonal test, and DEXA to see what is the bone mineral density, and T2 star MRI to see the iron storage in the multiple organ. And based on this test, the treatment protocol is become aggressive or continued the same. Now, how to cure this disease? The cure of this disease is bone marrow transplant. Basically, we need 100% match HLA, human leukocyte antigen, with a sibling or father and mother. In that case, when we have a 100% HLA match, we go ahead with a bone marrow transplant. There is 90 to 95% of success ratio for a bone marrow transplant in thalassemia, and we are currently doing at multiple centers in India, the bone marrow transplant, which has a very good successful rate. Now talking about curve of thalassemia. When thalassemia minor mother marries a thalassemia minor father, and when they are pregnant, we do a amniocentesis or CVS sampling test on the amniotic fluid, not the fetus. And we test this fluid for the genetic material of the fluid. And if it is thalassemia minor or normal, then we go ahead with the pregnancy. But if we come to know through the genetic testing, the fluid is thalassemia major, then we counsel the family and we do the needful as per the family's decision. Thalassemia currently in India is in highest number in the world. We are thalassemia capital of the world. That's why awareness like this is very, very important. Once we have a thalassemia child in the family, we do the extended screening of the whole family to see the thalassemia minor status of the whole family. If we know the status, we can take the preventive measure. There are certain type of diet which we follow in thalassemia, such as the products which has less iron, and we do not have iron rich foods such as pomegranate, khajur, and red meat is advised to be taken less. Milk products and iron lessen food are advised to be taken more. Exercising and lifestyle modification is very important aspect of a comprehensive care of thalassemia. Thalassemia's treatment doesn't mean only blood transfusion. It's a comprehensive approach where a pediatrician, a physician, a hematologist, a BMT physician, a endocrinologist, a reproductive medicine person, and a physiotherapist, a dietitian, a counselor, a social worker, and also a gastroenterologist has to be taken care of it. There's certain test and certain treatment modification done every year for this. This is all about thalassemia. Thank you.